So good evening to all. So today also the pharmacology class. So today I will discuss the topic that is the digoxin. Clear? The digoxin. Then the topic is the digoxin. Digoxin. Digoxin derived from the digitalis lanata. Here the digoxin is derived from the digitalis lanata. Clear? The digoxin is derived from the digitalis lanata. Then what is the side effect of digoxin? Here the side effect of digoxin. Side effect. Side effect is the first one is the nausea and vomiting. That is the earliest. It is the earliest side effect. Clear? This is a question. If the question asks in the examination, what is the earliest side effect of digoxin? That is the nausea and vomiting. That is the question. Here, the earliest side effect of digoxin is nausea and vomiting. Then the hyperkalemia. The second one side effect is the hyperkalemia, means the potassium level is high. That is the hyperkalemia. The normal potassium level is 3.5 to 5.5. If the potassium level exceeds in 5.5, then it is called the hyperkalemia. Then yellow vision. Yellow vision, also called the xanthopsia. Okay. The third side effect of digoxin is the yellow vision. That is called the xanthopsia. The other name of the yellow vision, that is the xanthopsia, or the medical terminology is the xanthopsia. Then blurred vision. Blurred vision. Then there is the blurred vision. Then the gynecomastia. Gynecomastia. Yeah? That is the 5 side effects of digoxin. That is the earliest side effect is nausea, vomiting. Then second one is the hyperkalemia, high level of potassium level. Then yellow vision, that is the xanthopsia. Then the blurred vision, then the gynecomastia. These are all the side effects of digoxin. Then the contraindication of digoxin. Then the contraindication. Hyperkalemia. Hyperkalemia means the increase air plus level. Clear? When the digoxin is contraindicated, or which case the digoxin is contraindicated? The digoxin is contraindicated in hyperkalemia case. in the increased potassium level. Clear? That is the most common. That is the most common. First one. Then second one is the hypomagnesemia. Hypomagnesemia, also digoxin is contraindicated. Then the third one, renal failure. In renal failure, the digoxin also contraindicated. Then fourth one is the myocardial infarction. Fourth one is the myocardial infarction. It is the MI. Okay? The digoxin also contraindicated in the myocardial infarction. Is the MI patient, also called the heart attack. Then the bradycardia. Bradycardia means heart rate is less than 60 beat per minute. Yeah? The digoxin also contraindicated in bradycardia, means the heart rate is less than 60 beat per minute. In the case, the digoxin also contraindicated. Then, what is the therapeutic range and the toxic range of digoxin? Has the therapeutic range. Therapeutic range, that is 0.5 to 0.9 mg per ml. That is the question in the. That is the important point also, the question also. In the exam, the question asks what is the therapeutic range of the digoxin. The therapeutic range of digoxin is 0.5 to 0.9 mg per ml. That is the question. Write down this. Then the toxicity greater than 2.0 mg per ml. Yeah, if the digoxin dose exceeds then 2.0, that means the digoxin toxicity in the body. If the digoxin level exceeds the 2.0 mg per ml, means that is indicate the toxicity of the digoxin. Then another last and important point, is when we administer digoxin, always monitor K plus level. Clear? The digoxin causes the hypokalemia in the body, means the increased potassium level in the body. When we administer the digoxin, we must the monitor time to time in the potassium level. Clear? When we administer digoxin, always monitor the K plus level, means the potassium level. That is very much important, and it is the question in the entrance examination. So write down this. So this is all about the digoxin. Next class we'll discuss about a new pharmacological topic. So thank you to all.